If you often dribble after you finish peeing, this video is for you. Although dribbling after you pee is more common as you get older, it can be really annoying regardless of your age. In this video, I'm going to give you 5 easy tips to manage it. I'm Dr. Alex Hill. I'm a board-certified pelvic health physical therapist. Make sure that you subscribe to my channel for more videos on optimizing your pelvic health. Post-Micturition Dribble, or PMD, is when the urine stays in the urethra after you've finished peeing and it leaks out later. So that means you go to the bathroom, you finish peeing, you start to walk away from the toilet, and then drip, you have a little bit of dribble. PMD can happen among any gender, but it's much more common among men. PMD can happen for a lot of different reasons, so it's important to get checked out by your medical provider to see what might be causing your dribble. Some of the more common causes of PMD are weak pelvic floor muscles, which these are the muscles you can see here, your pelvic floor muscles. Prostate issues, so this is your bladder, your prostate, and your urethra. So if you have an enlarged prostate, or if you have the prostate removed, say for prostate cancer, then that can also cause PMD. If you have a narrowing in the urethra, if you have obstruction in the bladder, even if you have chronic straining with things like constipation or pelvic organ prolapse, or even just age-related changes can cause PMD. All right, now let's talk about some tips to manage and reduce PMD. Tip number 1 is pelvic floor exercises. So strengthening your pelvic floor. These are also called Kegel exercises. These help to strengthen the muscles at the pelvic floor and around the urethra to stop the dribble. So to do a pelvic floor contraction, you're going to imagine that you're pulling the penis in or that you're stopping the urine midstream. You shouldn't have any other muscles really kicking in, so your abdominals shouldn't be activating a lot, nothing in your glutes or your legs. Since these muscles are on the inside of your body, no one else should tell that you're doing them. If you're struggling with how to do Kegels and you're trying to get the contraction but you're not sure if it's right, make sure that you watch to the end of this video where I have a link to a video on how to do these exercises correctly, and I guide you step by step through how to do it. Even better, if you're having trouble with your pelvic floor, work with a pelvic health physical therapist. Once you know how to do a Kegel correctly, then you can start doing it as a program. So for your exercise program, you can start with holding for 5 seconds, relaxing for 5 seconds. Do that in sets of 10, 2 to 3 times a day. If you have pain at the pelvic area or you have worse urinary symptoms after you're doing these exercises, stop doing the exercises. With these pelvic floor contractions, you can also do a couple strong Kegels at the end of your stream once you finish peeing to help with getting any urine that's left in the urethra out of there. Next up is urethral milking, which is one of the most common ways to address PMD for people who have a penis. So after urinating, you're going to place your fingertips or your thumb right at the very back base part of the penis, and you're going to gently but firmly press up and forward. So you're milking that urethra out. You're getting that urine that's left in the urethra out of there. So you can see how this works in this model. This is the penis. The urethra is at the bottom part of the penis. So as you push forward, that helps to get any urine that's left out of there. All right, the next tip is trying to change the position that you urinate. So you can try sitting rather than standing up. Sitting is going to help relax the pelvic floor muscles to help empty the bladder and the urethra better. Or if you're in the bathroom or setting where you can't sit to pee and you're standing up, try leaning forward slightly and using a wall to support yourself. All right, tip number 4 is don't pee too often. I know this might sound counterintuitive, right? You should be urinating every 2 to 4 hours throughout the day. And if you're more tempted to go more often to the bathroom, just in case to avoid the dribble, this can actually train your bladder that it's time to go to the bathroom even when the bladder's not completely full, and it's going to train the bladder to have some bad habits. It's important to have a full bladder when we go pee because if it's full, that's going to help it recoil and contract better to help it better empty, versus if it's only a little bit full, there's not as much contraction there to get the bladder completely empty and to push that urine out of the bladder and the urethra. All right, my last tip is to work with a pelvic health physical therapist. So if you're struggling with PMD or other pelvic health issues, work with a pelvic health physical therapist. We have additional specialized training in assessing and treating bladder, bowel, and pelvic pain conditions. You'll get an individualized assessment and program to get the best results. To learn how to do Kegel exercises and also to learn more about what to expect in pelvic PT, especially for men, keep watching to the end of the video to get those links. Remember, managing PMD is possible with the right techniques and exercises. If these tips don't help, or if you experience any pain, discomfort, or worsening symptoms, make sure you consult your healthcare professional. Thanks for watching. If you found this video helpful, please don't forget to like, share, and subscribe for more content on pelvic health.